Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this cool, crisp morning. A little wet out there today, but our spirits aren't dampened. We're here because we've got such good news, so much progress being made, I think, Hawkeye, with the coronavirus. We also have a very special guest, Dr. Marissa Love. Marissa is one of our outstanding allergists, and she works in both as a pediatric and an adult allergist. She treats asthma, patients who have immunodeficiency disorders, and you know, we get a lot of questions all the time around COVID-19, around vaccine development, and what do allergies mean, and what does this mean? I think Marissa Love will be the perfect person to help us answer those questions. We're going to get to those in just a moment, but first, Hawkeye, how is it today?
You know, we are stable.
Yeah, it's okay. We'll take it right now.
We haven't moved much, and I think that's what we've heard from our partners around the city and that CMO call that you've organized. So I think we had around 70 yesterday. We have 69 acute patients.
I like 60.
Yeah, 60
Okay, we'll take it. I like 30 better, and I really like 0, but that's still better than 70 or 80 or 100.
Better than 80 and 100, yep. 25 of those 69 patients are in the ICU with 13 on the vent, still 65 in that recovery phase. So it's still, you know, 130 or so patients that we are still seeing for COVID taking up beds, and 4 of those remain on the vent. So just showing again, if you do get on the ventilators, sometimes it can take a very long time to get off. Hays is doing better, 22 infections, 19 acute, and then 3 in that recovery phase as well.
So you know, it feels like we're still at this stable plateau, and I don't want to jinx us, but today is the 6th, and if I do my math, we're about 12 days post-Christmas. We're not seeing a huge rapid uptick yet. Let's hope it stays there. If it does, it's because you are doing a good job. Wearing your mask, staying in small groups, keeping your distance, don't go out if you're sick, all the things we know.
Yeah, I think it's a high plateau. We would like it to be a lot lower.
You bet.
But we've also seen that the numbers in the Kansas City area, the new infections, are kind of taking an uptick too. So I think this is all a consequence, not just of Christmas, but of Thanksgiving even before that.
Yeah, now New Year's. But the answer is right here, folks. Remember, we've always said it. We can, if you just wear the mask, you know, you mask up that coronavirus, it'll protect us. Listen to Dr. Fauci. Listen to all of our staff. We can do great work together, but you got to wear the mask. Now, these guys are not socially distanced, I'll give you that, but remember, they are inanimate objects. You have to socially distance. Jill, let's see if there are questions from reporters.
Hey, good morning. Cody Holyoke with Channel 9.
Cody, good morning.
Hey, CDC has new numbers showing Kansas has the lowest vaccination rate in the country right now. On Monday, I remember when I asked, you told us specifically, Dr. Stites, that the problem isn't the amount of the vaccine available necessarily, it's getting vaccine into arms. So I just, from your point of view, from the health system's point of view, what are the holdups you're seeing and what, in your opinion, needs to change?
Yeah, good questions, Cody. So here's what I would say. First, still the same story. Call to arms. We got to get people vaccinated. I do think there's a data reporting issue for the state of Kansas, and I think that I'm not trying to make an excuse, but I'm going to say a couple of things here. The data reporting issue, it's hard to put the data in. So for every 15 minutes that we observe a patient after we do it, it takes us at least that long and maybe longer to get all their data uploaded to both the Kansas information and the CDC. So it's taking a while to get data entry done, and I think that's part of the story. But I do think there's been a lot of vaccine hesitancy. I'll tell you, we're doing pretty well. We are about 70% of the people we offer inside our health system are taking the vaccine. There are places in central and western Kansas where our numbers are closer to 50%. So we're going to really work hard on that and try to better understand why people are still reluctant around vaccination, even in healthcare workers. But I think we have to try to be leaders. And so that's one of the reasons that Hawkeye and I both have had our vaccinations on the air. The other thing that's important is we're starting to move inside our health system to vaccinate everybody. We hope by this weekend or early next week, we'll have vaccinated everybody in our health system, both those who are patient-facing and those who are not. And so trying to make sure we send a good message to the community, and then we'll start partnering with other organs of government like the county and others to try and help make sure that people who are healthcare workers and essential workers in our community are going to be vaccinated. So lots of good things to come to try and help people understand that vaccination is the only right way to go. But we're concerned that we've not seen a more rapid uptake. I do think there's a data reporting problem. And B, I think we need to really work on our public campaign to talk about how safe vaccination is. I've got a bruise on my right arm. I'll show it to you. If I can remember, I'll wear something tomorrow that shows you my bruise. But I feel fine. And I think, Hawkeye, you felt fine.
I feel fine, yeah.
And it is safe. Vaccination is not some scary brand new therapy, and it strikes me as so funny because people are so nervous about vaccination. Well, you're messing with the immune system. Coronavirus messes with your immune system. People aren't dying from vaccination, but look at how many people are dying from coronavirus. So when you really weigh the two, there's just no question about what is your better choice. And I think we just have to keep talking about that. So am I concerned that we're not getting more vaccine into arms? Yes, I am. Do I think there's a data reporting problem, and so that the actual real value of how many people we vaccinated is higher than what's being reported? Yes, I do. Do I know the exact difference? I do not. That's a Lee Norman question. And then I think ultimately we will continue to work to try and make sure that people understand that vaccination's safe.
I was just going to say, Lee Norman called yesterday. I haven't had a chance to tell you, and he is going to come on every Tuesday through January.
Awesome.
To take vaccine questions.
That's
he can only be on for the first 20 minutes.
Yep.
But we said we'll take it.
All right, we will take it, and I can mess with Lee Norman, and I enjoy that opportunity. That is the best thing. He's a very good friend, so I enjoy messing with him.
And I'd like to say that, we had an ICU call with Louis Satterwhite and Mario Castro here at the health system, and then other ICUs around the region as well today. And Lee Norman was on, as well as his counterpart in Missouri. And first of all, the thing that was consistent was the declination rate of the vaccination. Not only here in Kansas, about 30% declination with our health system, but also at other places in Missouri as well. And they were pretty adamant, too, that there are reporting issues that it's just not up to date and accurate. And that was the same thing from a vaccine planning meeting that we had with KDHE earlier in the week as well. So, I think we're doing well, certainly here at the health system, once we get vaccine and getting them into the arms of the employees. In fact, so much so that you said we've kind of opened it up to the rest of our employees now. So that is, I think pretty consistent as far as the people that are declining. But we've also had people who initially declined and came back and got it later once they were able to get more information and talk with people as well.
So also, just to say, Cody, one other important point, Vizient is an organization for academic health systems as well as other health systems that serve large populations, and it's probably one of the best organized data reporting of all the different organizations out there. And there was a question to CEOs that was posted, and Bob Page shared the results of that. And the question was, how is vaccination going in your facility? And the answer is, across the United States, and there were probably 30 or 40 responses, and I'm talking about Yale and Penn and Emory and other state universities like ourselves and Stanford, and everyone across the country. The uptake of vaccination in almost every academic medical center is ranging from 50 to 80%. We're right at 70. So I don't think we're actually different than others. And I'm not sure about the rural area of Kansas versus the other parts of the rural area of the United States. We have to go explore that a little bit more. But if academic health systems are any sign of how it's going across the United States, then I think we're all seeing about the same thing. So hopefully a lot of what we're seeing in Kansas is more of a data reporting problem than it is an actual vaccination into arms problem. And we'll have to get a little more information, though, to prove that point, I think.
Okay, quick follow-up on that. Along with data reporting and hesitancy, are there any other issues right now with just getting supply or anything like that, especially in the more rural parts where you have health partners?
I think that the vaccine is being distributed, and so that's my information right now. I don't want to say that there's another problem. Could we be more organized? We can always be more organized. The United States public health response in general, because we don't have the funding and the infrastructure for public health here that we once did, is handicapped. That's been well published. It's well reported. There's not much more to be said, but it is disadvantaged us. On a personal note, and as a physician, it scares and concerns me that a country that I I believe leads the world in so many regards, has struggled with its public health infrastructure to take care of its citizens. And I wish we had done a better job of that. But that's not new news. And I think that ultimately, hopefully America will take a lesson from this and work on its public health infrastructure, because we can save lives and we can do a better job than we've done.
Thank you.
All right, other reporter questions.
Yeah, hi, this is Ellen McNamara.
Hi, Ellen.
So I was just going to ask you guys, yesterday the FDA said, talk about just giving one dose of the Moderna vaccine to people to stretch it out. Were you guys relieved that they decided to just said, no, we're not doing that? I felt like it could have been very confusing if that were to happen. What are your thoughts about the FDA saying, no, we're not going to be doing that?
I totally agree with I think you've answered it for me, so I appreciate that.
Yeah.
I think you're right. I'll come back to it when I turn to Hawkeye.
Yeah, I mean, I think number one, it was a good stance to take. I think it's okay to speculate and question and ask, because your goal is to get as many people some immune reaction and some immunity to coronavirus. But we always have to understand that we have talked about follow the science, follow the data. The only thing we have the science and the data about is those 2 doses. So I'm happy they took that stance and are consistent with that stance. Now, if we want to explore it more and try to understand what would happen and what are the effects, and I think that's reasonable, but I'm glad that they did take that stance.
I'm going to turn to Marissa Love, our allergist, and I've already introduced you a little bit. But before we get into a series of questions we want to ask you, do you want to comment on your thoughts around the FDA action yesterday? Because it's something that you would know a lot about.
Yeah, absolutely. So I completely agree with you. I think it makes sense to follow the data and what's been done in the research trials. We don't have any data at all based on half doses or delaying a dose, and we know that 2 doses at an appropriate time frame has been very effective.
Yeah, I think that's exactly right. And so, Ellen, my answer is exactly the same. Going to a single dose would have confused the entire country. It would have confused us, I think, a little bit as physicians, because we try to act on data, and the data is clear. And the clear part of that data says that this is how the vaccine works, and it achieves 95% efficacy, and it does that on the 2-dose regimen. If we then want to study a single-dose regimen and see how well it compares to a 2-dose regimen, okay, let's do that. Let's take on that study, and we can see real data. We don't really have that kind of information. Remember one other thing. Vaccine isn't your only choice. The rules of infection control protect you. And I've said this before, I'll say it again. We prove it every single day right here in our health system, as does any other health system in the United States, where patients with COVID are congregated on a ward, and the staff who work and take care of those patients don't get sick with COVID. And why is that? Well, historically, now we're vaccinating everybody, so that's going to help, obviously. But before that, it's because people wore their masks. And if you mask up, you can mask the effects of COVID. That's the answer. So you can stay safe. We all want to get rid of COVID, and we want to get back to society as normal. I want to get back to the Chiefs and the Royals and all the things I love to do. But that'll take a little more time. We can get there safely.
Dr. Fauci's mask is under his nose just
It is. Oh, let me fix that. See, he would never
He
allow
didn't do
that.
Yeah.
So I think the other, to that point too, and Dr. Love's
Thank
point
you.
is, if we want to study it, that's great, because, certainly they are looking to study what we call mixed dosing, and that's if you have Pfizer on the first dose and Moderna on the second, or vice versa. Right now, it is not recommended that you switch dosing, but those are just questions that can be asked, but they need to be studied, and I think they are looking at doing those studies as well, because we have to assume that, especially if there are 2-dose regimens, somebody is probably going to get 1 dose, maybe go to another facility and get their 2nd dose, or something will happen where that will be done. So, but those questions can be asked, but they need to be studied, and get the data and interpret that data.
Other questions? All right, not hearing any. Well, Dr. Love, let me kind of go a quick roundtable with you. I know we've talked a little bit about some of the questions we wanted to ask, because we hear these questions almost every day. You're the content expert. Well, Hawkeye's pretty content expert. I just kind of bubble around about it. But I want to go ahead and ask you a few of these important things. So here you go. First of all, how likely is it to have an allergic reaction from this vaccine in general?
So in general, an allergic reaction to a vaccine is pretty rare. We're thinking, the data shows that it's actually about 1 in about 1 million that can have an allergic reaction that's severe, like anaphylaxis. So really rare to have a serious adverse event.
And just to say, you practice, you see a fair number of patients who've had COVID-19. Has COVID-19 impacted your practice?
Yes, it definitely has. So we see a population that's immunodeficient and has asthma. And so, those folks are prone to viral infections in general. And we have to kind of monitor them and make sure that, especially our asthma patients who can get viral induced exacerbations. And so we have to make sure that they are following appropriate infection control protocols as well to ensure their safety.
Yeah. So should you take the vaccine if you've had COVID-19 infection and recovered already?
Absolutely. There's, without a doubt, they absolutely should get the vaccine. We know that some people develop some natural immunity after getting the illness. However, we don't know how long that lasts. The vaccine itself has been shown to produce very strong immunity, so that is a better protection for the patient.
All right. And so what happens if you are on drugs that suppress your immune system and things like Cellsapt or some other therapy? What should you be on? Should you still get the vaccine?
Yeah, that is a great question. And everyone is on a different type of immunosuppressant. And so because the regimen can be different for each person, we really encourage those patients to have a discussion with their specialist. That person may need to get the vaccine at a different timing based on what medication they're on.
Yeah, but one of my thoughts had been that, gosh, if you're on drugs that suppress your immune system, it could make you more susceptible to some bad effects from COVID-19 and other infections. That seems like a reason to get the vaccine, not to avoid it.
Yes. Yeah, absolutely. I agree. I think that one of the most important things is to discuss risks and benefits with their specialists. And more often than not, the benefits really outweigh any potential risk of the vaccine. The risk of getting a complication from COVID is much worse than potential risk of a vaccine.
So if you have a food or kind of an insect allergy or latex allergy or some other stuff, should you still get it?
Yes, absolutely. So this population with an allergy to a food, oral medications, latex allergy, stinging insect or venom allergy, they are not allergic to any component of the vaccine. They are also not allergic to have never had an allergic reaction to the vaccine itself, so they're considered low risk. We absolutely recommend they get the vaccine.
What if my sister, my brother, my mama, my papa, let's say they all have terrible problems with their allergies, but I don't? Still okay?
Yes, absolutely. Again, if that person has never had an allergic reaction to the COVID vaccine, never had a severe allergic reaction to a component of the vaccine, the recommendation by the CDC and many societies is to get the vaccine. Honestly, there's very few absolute contraindications to getting the vaccine.
And what happens if you have a history like a mast cell disease?
Yeah, so there's very little data about evolving the risk of these patients and what their risk is in getting the vaccine and having an allergic reaction. So for my patients with mast cell disease or idiopathic anaphylaxis, I've asked them to have a discussion with me. And what we'll do is look at risks versus benefits. And if we decide that the benefit outweighs the risk, we will have them get the vaccine, but perhaps might have a longer observation time.
Yeah, that would make sense. How about if you've had a severe allergic reaction to other vaccines before? Say you have a trouble with the influenza vaccine.
Yeah, so again, I think that is a very concerning issue that many patients have if they've had an allergic reaction to the vaccine other than a COVID vaccine. And I'd encourage them to reach out to either their physician or their allergist to discuss risks versus benefits. Again, most of the time the benefits will outweigh the risk. And if they do get the vaccine, they'll have a prolonged waiting time.
Okay. And if you've had a severe allergic reaction to a component of this vaccine, although it's really a pretty simple vaccine, I mean, honestly, there's not a lot of components to this vaccine.
I know.
I mean, there's a lot of vaccines that have a lot more stuff in them than this one does. But if you've had an allergic reaction to polyethylene glycol or something like that, what would you think?
Yeah, so if a person has had an actual severe allergic reaction or an allergic reaction to polyethylene glycol, they should reach out to their physician so that they can have a discussion about possibly being referred to an allergist. There are ways that we can evaluate that allergy, look at their risk, and see if the benefits outweigh the risk of potential reaction to the vaccine. And in regards to the components of the vaccine, it's made out of lipids, salts, sugars, and the polyethylene glycol, and with the upcoming vaccines with PEG derivatives, those things are common in a lot of everyday products and a lot of medications that people use. They're even in some of the flu vaccines.
Yeah.
And correct me if I'm wrong, too. I think the amount that is in the vaccine compared to the other things that Dr. Love talked about is extremely smaller than when in the other exposures that she was talking about. Is that right?
That is correct, absolutely. So an example I give to my patients is if you've tolerated Miralax or a bowel prep, you have had way more polyethylene glycol than what's in the vaccine.
The damn cystic fibrosis patients all hate us because we use so much polyethylene glycol, known as Miralax or Go Lightly, because they have a problem with constipation and things like that in CF. And so, when you walk in, you say, well, I think we need to do a bowel cleanse. They look at you like, oh, not again. It's all polyethylene glycol. Okay, what happens if you've had a severe reaction to your first COVID vaccine? Is it safe to get the second?
Yeah, so right now a recommendation from CDC is to not get the second vaccine without further evaluation. And any person who has had a severe allergic reaction to the first vaccine or a questionable serious allergic reaction to the first vaccine should reach out to their physician, and they will likely send a referral to the allergist for further evaluation.
Because you could test for which part of the vaccine you're allergic to, and there's a way to blunt that problem. Oh, that's really good. So have you been able to get a shot yet?
I have.
Awesome. How'd you do?
I did just fine, actually. I had a little bit of soreness on my left upper deltoid, and then I was pretty tired that day, which meant that my immune system was responding to it very well, and no other issues.
Yeah, I had to tell Dayton Moore and I had to tell Andy I couldn't get out and pitch or throw around with Pat or the pitching staff. And I was going to be down for a few days, but I'll be back. So no worries.
We need to get you training them.
Yeah, I do. Well, they need, obviously, just a little help here and there. That's
no allergic reaction for the allergist. That's good.
That's awesome. That's good. All right. All right, Jill, let's see what questions are out there for us.
Well, Sue has one, and she says she worries that it's a silly one, but...
There is no such thing as a silly question.
Right. So is every reaction an allergic one? Or because sometimes you talk about the vaccine is working, which makes it sore.
That is not a silly question at all. That is a great question, Hawkeye. So you and Marissa are well poised to answer that.
I think, I would say, and she's going to be more of the expert on this, I think not every reaction is an allergic reaction. You can have an immune reaction. I think probably what would delineate the two is kind of what are the chemicals that are expressed in your body when that happens. And, again, this is medicine and physiology, and so it's not always going to be black and white, and it's only going to be this or that. But I think for the most part, if we're talking about an immune reaction, you're going to have more of the cytokines that are involved in inflammation or your viral response or your bacterial response, as opposed to an allergic reaction where you have different cytokines or different chemicals that are expressed. And I'll let Dr. Love kind of answer the rest of that.
Yeah, absolutely. So there are there are allergic reactions, which involve the allergy antibody, and then there's everything else. And there can be a lot of non-allergic reactions to vaccines. And actually, some of those side effects are non-allergic reactions to vaccines. There's very specific criteria and symptoms that classify an allergic reaction. Many times they're very quick in onset, and they'll happen within the first 15 to 30 minutes of receiving the vaccine. And so that's why we have the wait periods that we do. And many times, we're talking about rashes all over, hives, lip swelling, tongue swelling, difficulty breathing, throat closing symptoms. And usually it's a compilation of all those different symptoms that classify an allergic reaction.
Okay, well done.
Yeah, we have a lot of questions are pouring in. So here we go. Bridget wants to know, do you recommend the vaccine for people with an alpha-gal allergy?
Alpha-gal allergy. Okay, well, I can't tell what that is, so.
I know
Marissa,
what
you're
that
up.
is because we did a story on it. It's kind of
Yeah.
rare.
Go, Dr.
Yeah.
Love.
Yeah, so this is alpha-gal allergy is a red meat allergy that's kind of brought on by a tick bite that's specific to this region. And there is no component in the vaccine that involves mammalian product. And so folks with alpha-gal allergy need to avoid four-legged red meats and those byproducts for some people. And the vaccine does not have any of that.
Yeah, I think I'm glad I don't have that
That sounds
allergy.
bad enough
It
just
does.
having
I
that.
I wouldn't want to have that one. Okay.
Susan says, Dr. Love mentioned there are very few contradictions to getting the vaccine. Can she please tell us what they are? Just list them. That would be helpful.
Okay, there you go, Dr. Love.
Yeah. Number one is if you have had a allergic reaction to the COVID vaccine itself, right now the recommendation is to come see an allergist for further evaluation. The number two is if you've had a severe allergic reaction to a component of the vaccine, again, the recommendation is to seek further evaluation and have a benefit versus risk discussion with your physician.
Please,
Oh,
I'm
go
sorry.
ahead.
Good, no, I interrupted you. You go ahead.
The third one I was going to mention was if a person has had a severe allergic reaction to an injectable medication, and because some of those injectable medications can have PEG or polysorbates in them, the recommendation is again to get additional evaluation about their risk.
Okay.
This is not a vaccine question, but it is a COVID question. Cindy wants to know, are those with asthma at a higher risk for complications from COVID than the general public?
You know, it's interesting because what I've read, and Dr. Love comment on this, actually, it's funny, I would have said yes to that when we first started building this airplane while we flew it. But I think more recent data suggests that asthmatics are not necessarily at increased risk from COVID-19. Talk to us about that, Dr. Love, or am I wrong about that?
No, I think initially we were worried that folks may have an increased risk. What we do know about asthma patients is that many of them have exacerbations due to viruses, any viruses. And so the common cold can trigger an asthma exacerbation. A flu virus can trigger an exacerbation. And so similarly, the coronavirus or COVID virus can trigger an asthma exacerbation. And so that's how I think about it with my asthma patients. Are they at higher risk compared to other patients? Not necessarily so, but these asthma patients also need to be careful about not catching colds and viruses.
Yeah, really, again, for an asthmatic, the rules of infection control should be prevalent a lot, right? Because you don't want to get sick. But I would have thought that asthma, especially more severe asthma, would be associated with a more steep decline in response to COVID-19 from the general population. I think it looks more like it would if they got influenza or rhinovirus, and so it's not. It's a little different. And it's interesting what diseases COVID-19 seems to emphasize, Hawkeye. I mean, if you think about diabetes, obesity, hypertension, those are clearly do worse with COVID-19, but others aren't, and sometimes we're a little surprised by that.
Yeah, again, I'd certainly be correct if I'm wrong, but I would agree with you. I think we initially thought that because it affects the lungs, and we know how important COVID is for the lungs. But I think some of the initial data coming especially from childhood asthmatics showed that there really wasn't an increased risk of severe disease or
outcomes,
complications. And I think now with the adult population too, I think that's correct. They just don't seem to be at any more increased risk of having severe disease and death or anything like that. So.
Gretchen wants to know, please ask if those of us who take allergy injections need to be aware of anything. Should we wait?
Okay, Dr. Love. Dr. Love, you're very popular. I'm just going to say this means that we're going to have you back, because I don't think these questions are going to go away. All right.
And I cut off the question, but it may be inferred. They want to know, if I get my allergy shot, should I wait then before I get the COVID shot?
What do you think, Marissa?
Yeah. So if you get your allergy shot first, definitely wait 24 hours before going to get your COVID vaccine. Now, the recommendation from the allergy societies, if you get the COVID vaccine first, is to actually wait closer to 48 hours in case of a delayed reaction to the COVID vaccine.
Gretchen wants to know, I take an antiviral medication. Is the vaccine safe for me?
Okay, antiviral medications. It should still be very safe for you to get a COVID shot. That was a yes.
Yes.
Okay.
Yes.
Nancy, can the vaccine cause rejection of a cornea transplant?
Oh, boy, I don't think I've not heard anything about that, Hawkeye. Have you?
I've not heard any information. I wouldn't know what the mechanism of that would be. Again, so far what we're talking about, Moderna and Pfizer vaccines, are just the modified RNA to have your cells produce the spike protein, and so those
Spike protein antibody, right? And they produce spike protein, and then you get the
spike protein antibody. And it's going to be, the antibodies are going to be to all those regions on that spike protein, including that receptor binding domain, which is really the main part that binds to our receptor. So I don't know that there's a mechanism there, unless there's something on the cornea that resembles one of those small little pieces or areas on the spike, but I don't think we've heard anything about that at all.
Dr. Love, have you heard anything around that?
No, I have not. And, you know, when I explain this to my patients, I basically tell them, you know, your immune system needs to be able to recognize the virus. And so the mRNA mRNA vaccine is basically giving your immune system an instruction sheet on how to recognize it. We get this all the time, every day, with bombardment of other types of, you know, bacteria, viruses that we encounter every single day. So our immune system is well equipped to recognize foreign things and basically take a little piece of it so that they can remember it for the future.
Yeah, I think I would just like to comment, because you had mentioned something earlier, and certainly Dr. Love now, I'd just like to piggyback on that. That's important to understand that, you know, getting this vaccine in this small dose is really not much more, because our body does see, and we've talked about this before on the show, our body does see different foreign entities all the time, whether we are inhaling it, especially if we're working out in the garden or raking leaves, whether we are touching our eyes or our nose or mouth. You know, there are bacteria around all the time. There are other foreign bodies or entities like viruses. So our body is always sampling different organisms, whether it's bacteria, viruses, things like that. This vaccine really is nothing different, but it is probably a more safe instruction sheet, as she had said.
Yeah. I think it's important for people to remember that what we're doing with vaccination is to teach your body how to recognize a piece of the virus, so that when you get presented with a virus in your body, because you got in contact with somebody who also has SARS-CoV-2, that your body recognizes it right away, and that way we can neutralize the virus. That's what a vaccine really does. It's not manipulating your immune system to some evil degree. You're not going to get anything that's going to have some radio frequency in it that's going to allow people to track you. I mean, there's none of that in these vaccines, right? These are really designed to just kind of prime your immune system so it's ready to respond to prevent the virus from doing damage to you. And ultimately, what you have to decide, is the vaccine more dangerous than the virus? And I don't really think there's any real question about that. You can go out and read stuff on the internet, and especially with conspiracy well, that too, conspiracy theory things, that would make you think that this vaccine is going to be equivalent to mind control. And it's just, you just have to recognize that that's just not true. We've been vaccinating people for many, many years now with many different diseases, and vaccines save lives. It's going to save your life against COVID-19 potentially, and the lives of those who you love. So don't reject a call to arms. Remember, the call to arms is what will save your life.
Or another analogy is just, if you're going to take a test, it's just the information to take the test. Once you get in there to take that test, you have all that information to make those answers. Just like this, if you are exposed to SARS-CoV-2, that's a test for your body. You already have that information at hand, and so you have that immune reaction to protect yourself against that disease and severe disease.
I think it's a good time to ask Neil's question. I was kind of hanging on to it, but his question is, what does the 85 to 95% efficacy mean? Does it mean it prevents me from getting it? I have an 85% better chance of not getting it?
You bet. Let's talk about that, Hawk.
Yeah, so the simplest definition, or the simplest way to describe it, is it protects you from getting the disease. So that's all the symptoms. Maybe not getting exposed to it and having your body take up the virus, but getting that disease, and especially that severe disease. And that was really laid out well in the Moderna data about protecting against severe disease. And what we mean is going to the ICU, needing that high flow oxygen or that ventilator. So it doesn't protect you from getting the disease. If you're out and going to parties or going where there's large gatherings and nobody's masking and you're close together, you're going to get the infection. But now we want to protect you from getting the disease. And so the disease, again, is all the symptoms: the shortness of breath, the aches, the fever, the respiratory failure, needing to go to the ICU. So these vaccines protect you from getting the disease, where otherwise before these, we didn't have any means of protection. But again, that still does not negate all the non-pharmaceutical interventions that we need to do, and that's masking, not meeting in those large groups, continuing the physical distancing as well.
So here's how I would express this. Dr. Neil Garmacher has been on our show a number of times, and he is a long hauler. He's been a survivor of COVID-19, but it was hard. It was very hard on him. Imagine, and I say this to Neil and to everybody who knows Anil and to all who watch our program, if Anil had had that vaccination, Anil wouldn't have a trach. He wouldn't have been in the ICU. He wouldn't have had to struggle like he's had to stay alive and to regain his footing in life, because the vaccine prevents that. And I think that's what we all have to recognize in what is so special about this vaccine. The 95% effectiveness, which is amazing, really says that the vaccine is 95% effective at reducing the risk of severe complications. And we know that because in the trial with both Moderna and also with Pfizer-BioNTech, the patients who got sick and had to be hospitalized were all in the non-vaccinated or placebo group. And the ones who, I think there was one patient hospitalized in the Pfizer data and 0 in the Moderna. I may have that inverted. But people with the vaccine, they just didn't get that sick. And that is why the drug is 95% effective. That is why you want it.
Can you shed the virus when you have the vaccine?
Yeah, we think you can.
That's another good question.
We don't know enough about that data yet.
Yeah, we believe you can. There was maybe some signal on that early Moderna data suggesting you may not replicate and shed as much virus, but we don't know. And that's why, again, it's so important. Get the vaccination when it's available, but also continue to do masking, not meeting in large groups, distancing, washing your hands, all those things that we have talked about.
If you've had, several people are asking, if you had remdesivir, is it okay to get the COVID vaccine?
Yeah, so I think if you've had remdesivir, that means you've had the disease. And initially for our employees, we have told our employees that if you had the disease within 60 or 90 days, probably hold back from getting the vaccine so that we can allow other employees who haven't had the disease or have any immunity to get the vaccine. But I think we've moved past that now. And right now there is no minimum time between infection and vaccination. We just want to make sure you don't have the acute illness so that you're coming in to get the vaccine when you're acutely ill and potentially spreading it to others. So if you've had remdesivir, yes, you can still get the vaccine.
Couple of more.
Please.
Debbie says that her college-age asthmatic son started to have allergic reactions to allergy injections in his fourth year, so they stopped the allergy shots. He's not had an allergic reaction to flu vaccine since. Is he at risk with COVID?
What do you think, Marissa?
Yeah, so I think for him, I think it would be best to talk with his specific allergist about potential risk with the COVID vaccine. However, allergy shots are basically medicine with the items you're allergic to. So they have a higher risk of allergic reaction based on that concept alone. And so if he has not had an allergic reaction to any other vaccines, it does bring his risk lower than someone who has had an allergic reaction to the COVID vaccine or an allergic reaction to other vaccines. So I think it should be a discussion between him and his allergist, but most likely the benefits will outweigh the risk.
Okay.
There's so many good questions. It's so hard, but I'm going to give the last one to Julie. She says that she wants to know if the doctors have heard that MMR vaccine has helped the smaller children in the elementary schools with an antibody to help prevent COVID.
Yeah, that is something that's been out there, and I think there's some more evidence around it.
Yeah, that is certainly something that's being studied. They are looking at other vaccinations, MMRs, one, I think polio. They are looking at BCG, all this to prime your immune system. We don't know what the mechanisms are, but that is one of the theories that is being studied as well. And I don't know if Dr. Love has anything more to say about that, but we don't know for sure, but that is a theory, and that is a good question and a hypothesis that is currently being studied.
Dr. Love, any other thoughts?
Yeah, I mean, just really what Dr. Hawkinson was saying, there's not a lot of data out there on this. One thing to remember is that when you get these other vaccines, it's activating your immune system, but it's not specific to the COVID virus. And so it's not a specific recognition for COVID virus in the future. So if they have the opportunity down the road to get the COVID vaccine, that would be far superior.
Yeah. Well, listen, this has been just great, and we do have to have Dr. Love back now, so we'll be working on that. A couple quick things. So tomorrow is a special update. It is our 200th episode of this morning media program. We are excited about our guests. They are all return guests, but people who you guys are going to know and love. Dr. David Wild will join and look back with us at patient data around the pandemic and also make some forecasts. Dr. David Lisbon will share how the pandemic has affected emergency medicine and also other special populations at risk. And Dr. Catherine Satterwhite, who is the Regional Health Administrator for the United States Department of Health and Human Services, has news of a federal initiative for maternal health and how it relates to COVID-19. That is an action-packed program tomorrow. So hang on and be with us. We're going to have a lot of fun because Hawkeye and I are going to be back too. So that'll be great.
This has been fun.
This has been great.
Dr. Love's great.
Dr. Love, final thoughts from today.
So my main message to everyone is if you have additional concerns about your risk to the COVID vaccine and having a potential allergic reaction, I strongly recommend you reach out to your physician and have a discussion with them, and they may consider referring you to an allergist like myself.
All right. Well, and we know you'll do a great job. So thank you so much for being on the program. Hawkeye, final thoughts.
I'd just like to thank Dr. Love. I think we had some really good questions. Again, no questions are silly. Ask those questions. Ask them of your medical providers. Ask them of trusted people. Try to do the best research that you can. Again, there are sources of truth out there, the FDA, the NIH, the CDC. Try to get those sources of truth and understand really what your question is and what the answers you are, and people will be happy to answer them. So,
yeah, tomorrow's a big day, 200. We wish it had never come to that.
No.
But it has, and so we'll be with you, and we'll be with you going forward until we have this darn pandemic under better control. You know, these masks. We've been talking a lot about the vaccine, but remember that the rules of infection control have kept you safe, will keep you safe, and can travel with you wherever you go. And they are the rules to follow. And this mask up the coronavirus by listening to Anthony Fauci and our healthcare team. Masks work. And you know, I got some cool masks for Christmas. I'm going to show a few of those. My sister sent me some, but today I'm going to show one that was brought from one of my very best friends who I go fly fishing with. And I look so good because now I look like a brown trout. Isn't that the best? I look like a brown trout. So thank you, Bill Lynn Scott. That is like the best mask ever. Hey, a couple of last thoughts, if I can get the thing off my ear. So maybe I can't get off my earpiece. So this vaccine thing, Cody asked that question. Are we disappointed that we can't get more people to get the vaccine? I don't think we're disappointed yet. I think we're just early in the game. Our lives are in suspended animation. Doesn't it feel like that a little bit? Yeah, that's kind of a Star Trek thing. But we're just waiting. We're waiting. We're in suspended animation, waiting for our next big thing to help us get out of the crisis. And that next big choice is coming to you. And you're going to have to make that decision. Do I have the faith to believe in hope and science to get us through? I hope that you do. It's a hard time right now, but we have to give grace. One of the things about grace is that because somebody chooses not to take the shot, I don't think we can criticize that person for being bad, because these things are scary. So we should give grace. But with grace, we should also give a warning. The choice you make to not be vaccinated can affect the rest of the world, and certainly the rest of your known world. So we'll give grace, but try to find faith and hope in science, because it can deliver us and help deliver us out of this crisis. We're going to show you a short video. Answer your call to arm. Don't throw away your shot. Send this out wide. I have a hard time saying that because it feels a little like self-promotion, but the point is we want you to share it with others so that the world and everyone around us can make the choice to be safer. Don't throw away your shot. This is our golden opportunity. Answer the call to arms. When the call to arms comes to you and you say, not me, not yet, what it means is you're saying to the coronavirus, step in front, go ahead. So the choice is one of two. You can take your call to arms, don't throw away your shot, and begin to help us beat coronavirus, or say, Corona, go ahead, take a step in front of me. Come for me, come for the other ones I know and love. That's the difference, and that's the decision you have to make. Do not throw away your shot, because this is incredibly important. This is how we win the game. This is how we win a pandemic.